Did you know that by keeping your blood pressure down, that can actually keep your hearing up? Hi, I'm Dr. Anita Carroll here, audiologist, and it's February Heart Month, and I think it's a great time to discuss the connection between hearing and cardiovascular disease. It really is all about blood flow. So, did you know that hearing loss and cardiovascular disease go hand in hand? Most people don't realize that. So, cardiovascular disease causes hardening of the arteries and restricts blood flow. So that this is a factor that affects your entire body, and including your inner ear that no one really thinks about. So when this restricted blood flow and hardened arteries occur in your cochlea or your inner ear, that's going to cause irreversible damage to those delicate structures. Now, high blood pressure actually impacts the vessels, the tiny little artery and vein that go through the cochlea. If that's impacted, that is actually going to cause permanent hearing damage to those hair cells that actually send sound to the brain. So, when you talk about the connection between hearing loss and heart disease, many of the things that you do to manage heart disease can actually manage hearing loss. For example, we all know that a healthy diet, balanced diet, remaining active, exercise, and reducing stress can all lessen the impact of cardiovascular disease. Well, that's also true for hearing loss. That can prevent hearing loss damage, inner ear damage, from those impacts for restricted blood flow or high blood pressure or hypertension. So keeping your eye on your blood pressure actually is going to lessen the risk of permanent damage to your inner ear. And of course, when the inner ear is damaged, then that results in hearing loss. So you may already know the things that you can do for managing your cardiovascular health, but a lot of people don't realize that they can do those things to manage their hearing health as well. So if you do have a history of heart disease, it's essential to get a baseline hearing test. This is going to monitor the baseline, the hearing levels that you're hearing at as your cardiovascular disease is monitored and managed. And if we see any changes in your hearing, then we are more likely to prevent that damage as it goes further on in your age-related hearing loss. So monitoring is very essential when you do have cardiovascular disease. If you suspect that you have a hearing loss, the link between cardiovascular disease and hearing should be a great reason to get your hearing checked. The ears actually can give us a peek into the status of your cardiovascular health. So maybe it's time to get your hearing checked for less than obvious reasons. So I'd like to say goodbye for now. Take a look at your hearing. Just kind of notice how you're hearing. Keep an eye on your blood pressure. If you have a history in your family of either hearing loss or cardiovascular disease, that's another risk factor that you would behoove yourself to get the hearing checked, as well as stay on top of your cardiovascular health. So if you enjoyed this video, please like it, share it, and subscribe to our channel if you can. And you have a wonderful day and fabulous February. Take care. Bye-bye.